This is the first lecture of two parts on the lymphatic system and immunity. In this lecture, we will talk about the lymphatic system, and then in the second part, we will talk about the immune system. Before we begin, on the last lecture on the endocrine system, we were cut off with the last two slides. I wanted to briefly go over those, and then we will move on to the lymphatic system. At the end of the last lecture, we were talking about the physiologic response of the body to stress. And we said that stress can be of several kinds. It can be physiologic stress or physical stress, such as this poor gentleman here, or it can be psychological stress for you getting ready to take your exams. Both of those cause reactions in the body and lead to what are called the acute or urgent state of stress release, and then the long-term or resistant stage. And this chart basically shows that the reaction to stress and stressful situations, both physical and psychological, is driven by the hypothalamus of the brain. The hypothalamus of the brain can respond in two different ways. In the immediate or alarm stage, such as the man being chased by the hippopotamus, the sympathetic nervous system will kick in, which basically does two things. It does cause sympathetic nerve fibers to release neurotransmitter, norepinephrine, which is going to cause all of the things we talked about when we talked about the sympathetic nervous system: dilation of the pupils, increased heart rate, increased contraction of the heart. It's also going to stimulate release from the adrenal medulla of epinephrine and norepinephrine into the bloodstream as hormones. Remember that the norepinephrine here is being released by post-ganglionic sympathetic neurons. This is actually being released into the bloodstream, where it goes to those organs and augments those same effects that we talked about before. That's the immediate or alarm stage. Long-term exposure to stress is also driven by the hypothalamus through increasing the release of corticotropin-releasing hormone. Corticotropin-releasing hormone is that releasing hormone that then travels down to the anterior pituitary gland, causing the release of adrenocorticotropic hormone, which then is released into the bloodstream, and it reaches the adrenal cortex, where the hormone cortisol is released. And cortisol is a hormone that is released in response to chronic, or is released in high amounts in response to chronic or long-term stressful situations. And it basically causes certain changes in the body. For example, it causes the increased body's accumulation of amino acids by basically protein breakdown. It causes the increased release of fatty acids. That means triglycerides are breaking down, releasing fatty acids, which are then going to show up in higher numbers in the bloodstream. It's going to increase the formation of glucose from non-carbohydrate substances, such as certain amino acids. They can be actually changed chemically by the body cells, produce glucose, which will then be released into the bloodstream. So you will see an elevation in your blood glucose levels. So these are changes that occur long-term exposure to stress, and these are one of the reasons why many people think that a lot of disease like heart disease is brought on, at least in part, by a chronic exposure to stressful situations, which is why a lot of times we recommend that patients try and avoid stress as much as possible, because it does have negative impacts on the body's physiology due to this long-term stressful resistance stage. This final chart actually goes over what we just talked about. It talks about the sympathetic responses to the acute stress, and then it talks about the long-term responses. And it talks about some of the things that are associated with those as far as the hormonal aspects of it, and you can read through that. That ends the discussion on the endocrine system. We're going to turn now to part one of the lymphatic system and immunity, and talk about the lymphatic system. The lymphatic system is a collection of vessels that transmits lymph, which is excess tissue fluid. Remember, we said that in the capillaries, there is fluid, more fluid generally leaks out of the capillary than is brought back in, and that excess fluid needs to be carried away, and it's carried away through the lymphatic system, and then emptied back into the circulatory system. We'll talk about how that happens. It is closely associated with the circulatory system. It is a one-way system that basically transmits excess tissue fluid towards two large collecting ducts, which are going to then empty into the right and left subclavian veins, emptying the lymph into the back into the circulatory system. But before that lymph enters the circulatory system, it is filtered through specific structures known as lymph nodes, where the lymph is then exposed to the body's defense mechanisms that we'll talk about in the second half of this lecture, so that any foreign material can be identified and the body can mount an immune response. Unfortunately, the lymphatic system also provides a method for certain abnormal cells and cancers to transfer themselves from one place to another, which is important in management of those conditions. This is a diagram kind of showing an outline of the lymphatic system. What you see here is this is the systemic system with the aorta pumping blood throughout all the body cells through the capillaries, collecting into the superior and inferior vena cavas, and ultimately entering the right atrium. This is the pulmonary system, where the right ventricle pumps blood into the pulmonary trunk, ultimately through the capillaries of the lungs, collecting into the pulmonary veins, which then enter the left atrium. But as we said, when blood goes through these capillary beds, whether it be in the lung or at the level of the cells, generally more fluid leaks out of the capillary than is drawn back in, and that excess fluid is then collected into lymphatic capillaries, which pick up that excess fluid and then carry them through lymphatic vessels, and ultimately are going to empty them back into the circulatory system after filtering them through structures that we'll talk about called lymph nodes. Lymphatic capillaries are closely related to the systemic capillary beds. Again, this is a systemic capillary bed. Here's an arteriole leading into a systemic capillary bed, giving nutrients to all of these cells. These could be cells of any part of the body, and then collecting into venules and ultimately into veins. And the excess fluid that leaks out of these capillaries is then picked up into the lymphatic capillaries and then transferred through the lymphatic system to be ultimately emptied back into the systemic circulation. This is kind of a close-up of how lymphatic capillaries work. What you see here is these are body cells. They can be any body cells, but as excess fluid collects outside the lymphatic capillaries, these lymphatic capillaries have a single thin wall of endothelial cells, very similar to a capillary, and their cell membranes overlap slightly, forming one-way valves, so that when the pressure of fluid outside the capillary increases, it pushes fluid, opening those valves and emptying that excess fluid between these cells and into the lymphatic capillary. And then if the lymphatic fluid tries to get back out, that valve slams shut. So lymphatic capillaries work by having a single layer of flattened endothelial cells that somewhat overlap, creating one-way valves, so that as excess tissue fluid builds up outside the lymphatic capillary, it is forced through those valves into the lymphatic capillary. Once the lymphatic capillary then empties into a lymphatic vessel, you then have no more transfer in and out. The only place that lymph can transfer in and out is through the lymphatic capillaries. Once you get past the lymphatic capillaries and into the lymphatic vessels have a similar orientation to veins in many cases. They still have an inner lining of endothelial cells. They have a smooth muscle layer outside of that, and then connective tissue on the outside of that. Some lymphatic vessels will actually even have valves, much like veins, to prevent backwards flow. The lymphatic vessels then we're going to collect with other lymphatic vessels in those areas and ultimately empty into what are called lymphatic trunks. Lymphatic trunks are larger vessels that collect from the smaller lymphatic vessels, and they're named for the regions they serve. For example, the lumbar trunks are in the lower back area. They collect the lymph that has drained from the legs. The intestinal trunks drain the lymph that's been collected from blood flow to the visceral organs, mainly the intestines. The intercostal trunks, inter meaning between, costal meaning ribs, they collect the lymph that has been formed between within the rib cage and the thoracic cage. The bronchomediastinal trunks. Broncho means bronchi, mediastinal means that area of the thorax between the lungs. That area of the lungs, the heart, and whatnot drain through bronchomediastinal trunks. Subclavian trunks on the right and the left sides drain the right and the left arms and the lymph that's coming back. Remember, all of the lymph is moving centrally and superiorly in the case of the lumbar trunks and the intestinal trunks. And then the jugular trunks drain the blood flow that's coming down from the brain, and they run along the jugular vein. This is another diagram showing these trunks. Here's the lymphatic vessels that collect to form the lumbar trunk from the legs. The intestinal organs empty into intestinal trunks. The intercostal trunks drain the lymph that's collected from the chest wall. The bronchomediastinal trunks drain the lymph that comes from the lung area, comes from the heart region. The jugular trunks drain the head, the right one on the right side, the left one on the left side. And then the subclavian trunks drain the arms. This is the left subclavian trunk draining the left arm, right subclavian trunk draining the right arm. Why is this important? Well, it's important because, again, diseases and cancers can be spread along the lymphatic system. So if you know where a cancer begins and you know where it drains into lymphatic-wise, you can know an idea or get an idea of where that cancer can be spread to as it moves on its way. Ultimately, the lymph is going to enter one of two collecting ducts. The jugular trunks from the head, the subclavian trunk from the arm, the intercostal trunks from the chest are all going to drain on the right side into what's called the right lymphatic duct. This diagram shows the area of the body that drains into the right lymphatic duct, and it's basically the right side of the head, the right arm, the right side of the chest, and the thorax. Those empty ultimately into the trunks collect together into a right lymphatic duct, which then empties into the right subclavian vein, and then ultimately into the right brachiocephalic vein and the superior vena cava. All of the rest of the body, the left side of the head, the left side of the chest, and thorax, the left arm, the abdomen, and both legs all collect into a collecting duct called the thoracic duct. The thoracic duct receives the left jugular trunk, the left subclavian trunk. It receives the bronchomediastinal trunks, the intercostal trunks on the left side, all of the trunks from the lower abdomen, the intestinal trunk, the lumbar trunks, all of those collect into the thoracic duct, which then empties into the left subclavian vein, which then empties into the left brachiocephalic vein and ultimately into the superior vena cava. This diagram over here shows that most of the regions of the breast actually drain through lymph nodes into the axilla or into the axillary area, which is why certain types of cancers like breast cancers tend to spread into lymph nodes in the axillary region, and this is one area that's looked at for the spread of cancers. Some cancers on the very medial aspect of the breast, which are much less common, will actually drain into the bronchomediastinal trunks instead. So basically the flow of lymph is going to be, lymphatic capillaries are those vessels that collect that excess tissue fluid. They consist of one layer of flattened endothelial cells that overlap, creating one-way valves. They then empty into afferent lymphatic vessels. Afferent lymphatic vessels are vessels that empty into structures we're going to talk about in a minute called lymph nodes. Lymph nodes collect the lymph from the afferent vessels and filter them through these structures, and then the lymph leaves the lymph node through an efferent lymphatic vessel. Ultimately, the lymph is going to enter a lymphatic trunk, as we talked about, and then ultimately end up in one of the two collecting ducts, either the right thoracic duct, the right lymphatic duct, or the thoracic duct, and then ultimately empty into the subclavian vein. So as we said, lymph is basically excess tissue fluid that has left the capillaries and is picked up into the lymphatic system. We remember this when we talked about capillaries. This is basically a capillary here, and it shows that here's the arteriole that leads into it, here's the venule that collects it at the end, and we said that during that capillary, in the beginning of that capillary, the hydrostatic pressure on the wall is greatest, and so you get a large amount of force pushing fluid out at the beginning. As that fluid leaves, you get lesser fluid pushing out at the end, and when you add up the net forces pushing in and pulling back, you ultimately end up, for the most part, at a net outward pressure between 8 and 10 millimeters of mercury. And because of that, there's a net flow out of the capillary into the tissues. So there's more fluid that leaks out than comes back in, which that fluid, if it had no way of disseminating, would lead to a condition called edema, which is increased fluid buildup in the extracellular space due to increased leakage from the capillaries. Certain conditions like allergic reactions we've talked about can make your capillaries more leaky, letting more fluid out, causing more excess tissue fluid and causing the swelling that you see when you have an acute allergic reaction like getting a bee sting and so forth. So what can leave through the capillaries to form this fluid? Well, mostly it's water with dissolved ions in it, very, very small substances, usually cells like red blood cells, white blood cells, platelets, and most proteins cannot get through out of the capillary. Small proteins can, but most of the large ones cannot. Ultimately, as we said, there is a net excess of fluid outside at the end of the capillary than in, which means that fluid needs to be picked up somewhere, and as that fluid builds up, the increased hydrostatic pressure of that fluid actually forces that fluid through those overlapping lymphatic capillary cells and into the lymphatic capillary, leading to the process of lymph formation. This is another diagram showing how that happens. This is a lymphatic capillary with its overlapping cells here. This is tissue fluid out here. As the pressure of tissue fluid increases, that lymph is forced between those cells, those endothelial cells, into the lymphatic capillary, whereas more fluid enters, the fluid that's in there is pushed forth into the lymphatic vessels, and once you get to the lymphatic vessels, the walls are too thick for anything to get in and out. Since this is a very low pressure system, the major force of movement of lymph within the lymphatic vessels is the production of more lymph behind it, pushing it out. Also, skeletal muscle activity, basically as you walk around during your day, contracts your lymphatic vessels. And again, lymphatic vessels do have valves in them to permit only one-way flow, much like veins. So the flow of lymph in the lymphatic vessels is very similar to the flow of blood in the venous system. It's a very low pressure system that relies heavily on muscle contractions around those vessels to milk that lymph along that lymphatic vessel, past the lymphatic valves, and on their way back towards the right lymphatic duct or the thoracic duct. Along the way, the lymph is filtered through organized structures called lymph nodes. A lymph node is a structure that basically filters lymph. In other words, the lymph arrives at the lymph node, and lymph nodes generally have a somewhat roundish shape. They have an indented region in one area called the hilum. The hilum is where the efferent lymphatics come out. That lymph that's filtered through leaves the lymph node this way. Lymph usually enters via several afferent lymphatics, where it then empties that lymph into this lymph node. The lymph node has really two regions. It has an outer cortex. The outer cortex has these rounded structures which are called germinal centers. These germinal centers tend to have a specialized type of lymphocyte called a B lymphocyte in it. These are part of the body's immune system. We will talk about them in the second half of this lecture today. The medulla of the lymph node consists of largely free, non-organized lymphocytes that are called T lymphocytes, as well as macrophages. Macrophages, as you know, are those cells that are produced by the body from monocytes, and they basically are phagocytic in nature, and as we will talk about in the second half of this, they have a secondary function of activating the body's immune response. So this diagram down here shows a light micrograph of a close-up of a lymph node. These are those germinal centers that are largely made of B lymphocytes. This is the capsule that surrounds the lymph node, and then this is the medulla of the lymph node, generally free of germinal centers, but full of tiny little cells, of which many are macrophages and many are T lymphocytes. And then the lymph, which is delivered to this lymph node, percolates through this, exposing the lymph to these regions, and then ultimately exiting through the hilum, through efferent lymphatics, once the cells in here have gotten a look at what's there and had the ability to identify foreign material that's passing through with the lymph. This is a light micrograph actually showing a lymph node. This is a lymph node sitting on the surface of a muscle. This is muscle tissue here. This is the lymph node. These are the lymphatic vessels. Some of them are afferent, some of them may be efferent. You can't tell by looking at them, but basically the lymph is delivered to this lymph node, percolates through it, and then leaves through efferent lymphatics. As the lymph passes along the lymphatic vessels, the lymph is drained through these lymph nodes. And again, these lymph nodes have an organized structure so that they can expose the lymph to cells of the body's defense system and phagocytize both foreign material and activate the body's immune system if needed. This is another diagram again showing a lymph node. These are the afferent lymphatics arriving, emptying the lymph. You can see this is a lymph vessel, so it does have valves in it. And as the lymph enters the lymph node, it percolates through this area in the medulla, where you have the macrophages, the T lymphocytes, and the cortex, where you have the germinal centers and the B cells. And all of these cells have a chance to look at what's coming through here, identifying foreign material. The macrophages can phagocytize it. The T cells can be activated by the macrophages if there's some type of an immune reaction to be developed to this, and then the T cells then will activate the B cells to produce antibodies if necessary. Ultimately, when the lymph filters its way through this lymph node, it then leaves via efferent lymphatics and continues on its way towards either the right lymphatic duct or the thoracic duct. These lymph nodes are actually clustered in certain regions. For example, the cervical region, both anteriorly and posteriorly in the neck, drains the lymphatic vessels as they come down from the head. They also drain the lymphatic vessels that come from the throat. This is why when you get strep throat, sometimes you'll get swollen glands. Those swollen glands are enlarged reactive lymph nodes that are reacting to the infection that you have in your throat. The axillary region of the arm also has clusters of lymph nodes that drains both the arm and, as we said, some of the chest and the breast. You have supratrochlear. Supra means above, trochlea means elbow. The supratrochlear lymph nodes, they actually are found in the medial aspect of the elbow area, just above that, and they drain infections of the hand. So sometimes if you get a splinter in your finger that develops an infection, you will get swelling of those supratrochlear lymph nodes there. The inguinal lymph nodes found in the inguinal area, right and left sides, they drain the legs. And again, if you get infection somewhere in the leg, you can get swelling of those lymph nodes as they react to that infection by producing clones of these lymphocytes, and that's what causes them to enlarge. The abdominal cavity has a series of lymph nodes that drain the abdominal viscera. The pelvic cavity drains the pelvic, and the thoracic cavity has its own. So all of these lymph nodes drain certain regions as those lymphatic vessels and trunks pass through those regions. They filter that lymph through lymph nodes. So lymph nodes do two things. They filter potentially harmful substances from the lymph by identifying them and phagocytizing them by the macrophages. But they also act as immune surveillance. In other words, they act to allow the immune system through the macrophages, the T and the B lymphocytes, to identify foreign materials and mount an immune response that we'll talk about in the second half of this lecture. Most lymphocytes are produced in the bone marrow, but then once they're seated in the lymph nodes, then they can make clones of themselves if they're activated to produce enlargement of that lymph node, which is what you see when you have swollen glands. Two other lymphatic organs that are similar to lymph nodes but have slightly different function. The thymus. The thymus is a lymphatic structure that's found in the mediastinum. It's found just superior and anterior to the heart, medial to the superior aspect of the lungs. It's a bilobed structure. It's very large in infants. It actually decreases in size in adults. And its primary job is the maturation of what is called T lymphocytes. The T lymphocytes we talked about in the lymph nodes are produced in the bone marrow, but they mature in the thymus, and then they're released into the system, or they're released to seed themselves into the lymph nodes. The thymus also produces protein, they produces chemical messengers called thymosins. Thymosins are hormone-like substances that are produced by the thymus that are associated with your body's immune system. Myasthenia gravis is a disease that's an autoimmune disease, which means your body makes antibodies against your own body cells. And in the case of myasthenia gravis, your body makes antibodies against the acetylcholine receptors on your skeletal muscle. Remember, we said all of your skeletal muscles, which are voluntary, contract when your motor neurons release acetylcholine, which then binds to those receptors and stimulates that muscle to contract. So if I'm going to close my eyes, I'm going to raise my leg, I'm going to wiggle my toes, all of those muscle contractions are produced by stimulation by motor neurons of those muscles by release of acetylcholine that binds to these receptors. Myasthenia gravis is an autoimmune disease, which means those people make antibodies, and those antibodies are made to their acetylcholine receptors. This is an antibody here, this is an antibody here. So now this individual here has this muscle that they may want to contract, but when they release acetylcholine, which they do to try and contract that muscle, there's not enough active receptors to actually cause a contraction to occur. These people end up with significant muscle weakness. They end up with what's called ptosis, or drooping of the eyes, muscle weakness, and in the most serious state, weakness of the respiratory muscles and death due to asphyxiation, because you can't take a deep breath, because you can't stimulate your diaphragm muscle to take a breath, because all of your acetylcholine receptors on your diaphragm muscle are covered up with these antibodies. Treatment for myasthenia gravis involves several different things. There are drugs that can actually increase the release of acetylcholine. There are mechanisms in which they can attack these antibodies. And one of the things that's done for people with myasthenia gravis is they actually remove the thymus gland that we just talked about. And it's found that the thymus gland, though much reduced in the adult stage as opposed to when you were a child, removal of the thymus gland it causes in many cases fairly significant improvement in the symptoms of myasthenia gravis. The spleen. The spleen is the largest lymphatic organ, and it's the only lymphatic organ that instead of filtering lymph, it filters blood. It's found in the left upper quadrant of the abdomen. It receives blood from the splenic artery, which is a branch off the celiac trunk, which comes off of the abdominal aorta. And that blood goes into the spleen, and it's filtered through a series of splenic sinusoids, much like the sinusoids we talked about in the liver. And then that blood is collected into a splenic vein, which leaves the spleen, and then it enters the hepatic portal vein and ultimately through the liver and into the general circulation. So the spleen is kind of unique as a lymphatic organ because it does not have lymph going through it, but actually has blood going through it. When you look at the spleen microscopically, you will see roundish structures very similar to the germinal centers we saw in lymph nodes. These make up what is called white pulp. White pulp are collections of lymphocytes that are found throughout the spleen. And then in between those areas is what's called red pulp. And red pulp basically consists of the splenic sinusoids lined with macrophages and other lymphocytes. So as the blood is emptied into the spleen through the splenic artery, which is shown in red here, it's then filtered through these sinusoids that come in contact with these lymphocytes, with these macrophages. and then ultimately leaves the spleen via the splenic vein. And this gives your body's immune system a chance to look at what is in your bloodstream, as opposed to looking at what is in your lymph. So the major organs of the lymphatic system: the lymph nodes, which filter lymph; the thymus, which houses lymphocytes. It matures T lymphocytes, and it's important in the production of hormone-like compounds called thymosins. And then the spleen, which is an organ that actually filters blood through a lymphocyte and macrophaged environment of sinusoids, allowing the body's immune system and the body's macrophage system to take a look at what's in the blood and have a chance to attack what's in there. That ends the first part of this two-part lecture on the lymphatic system and immunity. We will continue with part 2 on body defenses in the next lecture.